Sign and symptoms of obsessive compulsive disorder. Obsessive compulsive disorder, OCD, features a pattern of unwanted thoughts and fears, obsessions, that lead you to do repetitive behaviors, compulsions. It causes unreasonable thoughts, fears, or worries. These obsessions and compulsions interfere with daily activities and cause significant distress. What are the symptoms of OCD? Before we get into the video, be sure to subscribe and click the bell icon. OCD has three main elements. Number 1. Obsessions. Where an unwanted, intrusive, and often distressing thought, image, or urge repeatedly enters your mind. Number 2. Emotions. The obsession causes a feeling of intense anxiety or distress. Number 3. Compulsions. Repetitive behaviors or mental acts that a person with OCD feels driven to perform as a result of the anxiety and distress caused by the obsession. You may or may not realize that your obsessions and compulsions are excessive or unreasonable, but they take up a great deal of time and interfere with your daily routine and social, school, or work functioning. Some common obsessions that affect people with OCD include spending long periods of time touching things or counting, fear of contamination by disease, infection, or an unpleasant substance, fixation with order or symmetry, troubled by thoughts that are against personal religious beliefs, a need to have things in a very specific order, fear of deliberately harming yourself or others. Common types of compulsive behavior in people with OCD include checking and rechecking to make sure that a door is locked or that the oven is turned off, cleaning and repeated hand washing, often 100+ times a day, following rigid rules of order, such as putting on clothes in the same order each day, thinking neutralizing thoughts to counter the obsessive thoughts, alphabetizing the spices, and getting upset if the order becomes disrupted, avoiding places and situations that could trigger obsessive thoughts, repeating words in their head, asking for reassurance. Risk factors for OCD. Symptoms usually begin gradually and tend to vary in severity throughout life. The types of obsessions and compulsions you experience can also change over time. OCD is a common condition. It causes persistent disturbing thoughts and compulsive rituals that attempt to ease anxiety. The rituals become consuming and interrupt daily life. Stressful events may trigger the OCD episodes or make them worse. You may or may not have insight into the irrational thoughts or behaviors. Medicines and therapy can help reduce the time spent in the thought patterns or compulsive behaviors. Treatment is most successful when both are used. Symptoms generally worsen when you experience greater stress. OCD is diagnosed during a physical and psychiatric exam when obsessions and compulsions. Most patients with OCD are aware of the behaviors they are displaying, they just cannot stop them. How is OCD treated? It's important to get help if you think you have OCD and it's having a significant impact on your life. Tips to help you get the most from a visit to your healthcare provider. Psychotherapy is another important aspect of treatment and generally recommended in conjunction with medication use. OCD is unlikely to get better on its own, but treatment and support is available to help you manage your symptoms and have a better quality of life. That's all for today. Did you learn anything here? We're waiting for your response in the comments. If you enjoyed this video, don't forget to like, subscribe and share it with your friends. Thanks for watching and see you on another videos.